I'm a palliative care nurse. I've worked specialised in palliative care for the last 15 years, but I've been nursing longer than that. Being a palliative care nurse is really what drove me to working in an area called advanced care planning. Now, a lot of people haven't heard of advanced care planning, but in the not too distant future, I'm sure everybody's going to hear about advanced care planning. And currently I'm working on a national project. That national project is called the Advanced Project, and it's assisting people working in general practice, so GPs, practice nurses, practice managers working in general practice, to initiate these advanced care planning conversations early, when people are well, when there's no diagnosis, you know, so hopefully people will hear about this more and more. But at the moment, a lot of these conversations are being had when someone's referred to palliative care, or when they're presented to hospital, or when they're in a crisis situation, and we don't want that. We want these conversations to be had at other times. So what I'm going to cover today is what actually advanced care planning is, where to find the best documentation, because if you were to Google advanced care planning or advanced care directives, so much information comes up and it does get confusing and overwhelming, so I'll just direct you on the most relevant information. I'm also going to touch on palliative care and what palliative care actually is, because from my experience I know that the majority of people in the community, and also a lot of health professionals, don't really truly understand what palliative care is. So I'm just going to clarify that. And I'm also going to touch on the New South Wales Authorised Adult Palliative Care Plans. Okay? Sorry, I thought you had your hand up. Yeah, so I'm going to go through what they actually are and how they're utilised in the community. So basically, advanced care planning is a process. So it's not just a one form that you tick off and you fill in details. It's a process of planning for future health and personal care, whereby a person's values and preferences are made known so that they can guide decision-making at a future time when the person cannot make or communicate decisions. So that's basically what advanced care planning is. It's a process. And as I said, it's ongoing. It needs to be revisited. And as things change, your ideas and what your wishes are will change. So it's an ongoing process. So basically, we're wanting people to think about who would they trust to make healthcare decisions and what would they want them to say. So yes, advanced care planning is the overarching definition, which pretty much covers the ongoing process of people stopping and reflecting on what matters most to them, thinking and considering things that are important to them, reflecting, and then very importantly, and I think most importantly, is having a conversation with your loved ones around that. So everybody then is on the same page and everyone knows what your wishes are. So it's a process, and all those different areas are so important. When you have had those conversations, when you go the next step, you can actually, you don't have to do this, but you can put it in a written format. You can write it down, and if you do, it's called an advanced care directive, and that becomes a legal document. And your family and also health professionals can't go against what your wishes are, because it's an extension of your wishes, even if you can't communicate them anymore. Okay, is that clear for everybody? So that's what an advanced care directive is, and a lot of people get confused about the difference between advanced care plan and advanced care directive. An advanced care directive can only be done by the person on behalf of themselves. It can't be done by other people. But if you were to have and I don't want to confuse you, but if you were to have an advanced care plan, families can contribute and health professionals can contribute to that. Okay, so in New South Wales, and to confuse a little bit further, in other states in Australia, the terminology is different, the forms are different, and the laws are different. Okay, so in New South Wales, you know, it needs to be written down. It doesn't need to be signed or witnessed, and it can still be held legally as a legal document. But what we strongly recommend is that you complete an advanced care directive, you include your family or anyone that's going to be involved in decision making, and then you share it with anyone that's going to be involved in providing care. So your GP, the nurse, if there's a nurse involved, and also any specialist that's involved. Sometimes people will say, I've gone and done my advanced care directive with my solicitor, which you don't actually have to do. They said it cost me however many thousands, which you didn't have to spend. And then I say, great, where is it? And they say, oh, it's just still sitting with the solicitor 6 months later. That's not ideal. It needs to be shared with everybody, and everyone needs to know where it is. Your loved ones should have a copy, you should have a copy, GP and everybody else involved in your care should have a copy. So it informs us on how to best care for you. And we need to care for people the way they want to be cared for, and they need to tell us that so we can provide the best care possible for them. Okay. Being a nurse, I can't count the number of times people have come up to me and said, I'm power of attorney. And I always say, well, that means nothing to me, because power of attorney is in regards to financial decisions. An enduring guardian is the term used in New South Wales for that appointed substitute decision maker. And that, to me, really, I don't need to know who the power of attorney is. I need to know who the enduring guardian is, because that will assist me to care for people best. I'm not really ever involved in anyone's financial matters, but medical decisions, yes, I am. So does that clear the difference between the power of attorney and enduring guardian? And there's a lot of confusion out there with people who don't quite understand what the definitions are of both. So I'm just, any further information at all you would like to know on advanced care planning, don't Google advanced care planning, because lots of different information comes up. But what I would suggest you do is look up Advanced Care Planning Australia. It's a website with all the most updated resources there in regards to this. There's different information that's easily digested and understood on the website. You can go to the icon of Australia, click on New South Wales, and anything you need to know about advanced care planning in New South Wales will be there. I just thought I'd show you a video that is available on that website, because I think it's really summing up what advanced care planning is all about.
Life is full of moments when it's important to be open, to be ready, and to be heard. This is especially true when it's time to consider advanced care planning. To help, here's how you can plan for tomorrow so you can live for today. Be open to thinking about your beliefs and preferences for care. This includes thinking about what you value most and the treatments you would choose to have or not have. Most importantly, you'll need to think of who you would trust to make these decisions for you. Be ready to talk about your beliefs and preferences for care with your loved ones, your healthcare professionals, and make sure they understand the way you see things. Ask questions if anything is uncertain, and try to consider what they might need to know about you to make decisions later. Be ready to make choices. Starting with the appointment of your substitute decision maker. They'll need to be over 18, as well as someone who listens carefully and understands your preferences. Either way, it needs to be someone you trust to make decisions on your behalf. Be heard by documenting and sharing your plan. First, write it down so that if others need to make decisions for you, they'll know what you would have wanted. Share your plan with your loved ones, your substitute decision maker, and the healthcare professionals responsible for your care. This way, everyone's on the same page. It may be difficult, but it makes sense to plan for tomorrow so you can live for today. Be open, be ready, be heard. To make your plan, visit our website or call for advice and support.
Oh, I might just go back. Oh no, that's okay. I was going to say, the number's there, but if you go to the website, all the information is there. Thank you.
We also have some information.
Great, excellent. Thank you. So, as I said, being a palliative care nurse, I have experienced when somebody has had an advanced care planning conversation with their family and how care unfolds. And I've experienced also when it hasn't been discussed at all. and the outcomes of that aren't necessarily very good. Sometimes it's okay, but the outcomes can be that person not getting cared for the way they would have wanted to, and there's a lot of guilt and issues with grief and bereavement afterwards if the family is sitting back going, oh, hang on a minute, that's not really the way in which we would have, in hindsight, liked things to happen. So this is a bit of tongue-in-cheek of what the ideal family and situation is. Most people working as a health professional know that this doesn't happen very often. But ideally, a person has an easily identifiable family, friend or support network. Okay, the family has one spokesperson. The person has an appointed enduring guardian who knows exactly what their wishes are. And that enduring guardian knows exactly what medical decisions the person would want if they're in a situation where they couldn't speak for themselves. That way, the enduring guardian can follow the person's wishes and not feel guilty and are not put in a position where they have to make difficult medical decisions on behalf of what they think the loved one would want, because they'll actually just be following what their loved one's wishes are. So it becomes very straightforward as opposed to trying to guess what that person would have liked. They're just following their wishes, so it's much easier for family members. Also, very ideally for us, it would be great if all family members agree with each other. So what we find is all family members come from a great place, they come from a loving place, they want what's best for that person, but usually every single member of the family have got a different idea on what that is. So it's really difficult to navigate. And health professionals are spending a lot of time with families trying to come to a solution where everyone's thinking on a similar line. And we'd also really love it if family members live reasonably close by rather than in different cities, states, countries and various countries around the world. And also to be ideal if family members dealt with family issues or any conflict elsewhere, which doesn't happen. So in reality though, people often have advanced care planning conversations in a crisis situation. Okay, when they're confronted and they have to make these decisions and they have to have these conversations. And that's a time when the patient, the family, everybody involved is very stressed, and usually the person themselves is very unwell, so they're not in an ideal position to be having these conversations. We'd much prefer it when people are well to at least get the ball rolling. Okay. Also, what's very common is multiple relationships. Sometimes people have been married, 1, 2 or 3 times, and there can be all sorts of different spouses and partners that come into play when someone's unwell. People can be divorced, separated, widowed, children can be full, step, half-siblings, adopted, and usually people are dispersed throughout Sydney, Australia and overseas. So this is why it's so important to have these conversations, because a lot of the time people aren't involved in conversations, or there might be one member of the family that's involved in conversations, but when someone gets really sick, people fly in from everywhere and they can all have an equal say in what's going on, even if those conversations have been had with that one person that's been here the most of the time. And it does influence the outcomes for people. So as I said before, family members usually have different ideas and views on what appropriate care is. People appoint a power of attorney, but they're not aware of what that actually involves. And there's a lot of the time long-standing or recent conflict. Usually that's not relevant to the patient at all, but it's the sort of things that we're managing. And a lot of the time there's considerations in regards to legal matters or financial situations such as wills. It's really important why these conversations are done. So basically a substitute decision maker is the overarching definition of the person that's going to be making decisions on behalf of you if you can't make decisions for yourself. So if the health professionals were to go to the person for medical decisions on your behalf if you're not able to speak for yourself, the first thing they look at, and the first thing that usually gets asked when someone presents to an emergency department, do you have an advanced care directive? Okay, if they do, that's what they're going to follow. If they don't, they'll ask, do you have an appointed enduring guardian? That's the person that they'll be speaking with. That can be a friend, a family member, your spouse, it's whoever you have legally appointed through a solicitor to be your substitute decision maker, your enduring guardian. Okay, and then after that comes your spouse, de facto or same-sex partner, and as I sort of mentioned before, a lot of the time that can be a bit of a grey area. Okay, not always, but a lot of the time it can be. But it's a person with whom you have a close and continuing relationship. Under that comes your carer, or the person who currently provides support to you. And this person's not a paid carer, not an employed paid carer, but the carer can be receiving the carer support payment. And then after your carer comes, for the decision making, a close family or a close friend or relative, a person with whom you have an ongoing relationship. So that close friend or family could be your son and daughter, but the carer might have more of a say. So it's just really important for people to know that. Sometimes I will say not everybody needs to appoint that if it's all very clear and everyone's in a very mutual place amongst family and everyone has a very good understanding of what your wishes are. But if there's any inkling of doubt, it's really important to get this done. So it's quite straightforward. So as mentioned, the steps for advanced care planning is reflecting and thinking. You really need to have a think about what's most important to you. A lot of the time, people aren't involved in conversations, or there might be one member of the family that's involved in conversations, but when someone gets really sick, people fly in from everywhere and they can all have an equal say in what's going on, even if those conversations have been had with that one person that's been here the most of the time. And it does influence the outcomes for people. So as I said before, family members usually have different ideas and views on what appropriate care is. People appoint a power of attorney, but they're not aware of what that actually involves. And there's a lot of the time long-standing or recent conflict. Usually that's not relevant to the patient at all, but it's the sort of things that we're managing. And a lot of the time there's considerations in regards to legal matters or financial situations such as wills. It's really important why these conversations are done. So basically a substitute decision maker is the overarching definition of the person that's going to be making decisions on behalf of you if you can't make decisions for yourself. So if the health professionals were to go to the person for medical decisions on your behalf if you're not able to speak for yourself, the first thing they look at, and the first thing that usually gets asked when someone presents to an emergency department, do you have an advanced care directive? Okay, if they do, that's what they're going to follow. If they don't, they'll ask, do you have an appointed enduring guardian? That's the person that they'll be speaking with. That can be a friend, a family member, your spouse, it's whoever you have legally appointed through a solicitor to be your substitute decision maker, your enduring guardian. Okay, and then after that comes your spouse, de facto or same-sex partner, and as I sort of mentioned before, a lot of the time that can be a bit of a grey area. Okay, not always, but a lot of the time it can be. But it's a person with whom you have a close and continuing relationship. Under that comes your carer, or the person who currently provides support to you. And this person's not a paid carer, not an employed paid carer, but the carer can be receiving the carer support payment. And then after your carer comes, for the decision making, a close family or a close friend or relative, a person with whom you have an ongoing relationship. So that close friend or family could be your son and daughter, but the carer might have more of a say. So it's just really important for people to know that. Sometimes I will say not everybody needs to appoint that if it's all very clear and everyone's in a very mutual place amongst family and everyone has a very good understanding of what your wishes are. But if there's any inkling of doubt, it's really important to get this done. So it's quite straightforward. So as mentioned, the steps for advanced care planning is reflecting and thinking. You really need to have a think about what's most important to you. to get there quicker. When I have advanced care planning conversations with people, the most common thing people will say to me is, why didn't somebody mention this to us earlier? So I think sometimes it's health professionals that feel a little bit uncomfortable initiating these conversations, but it doesn't ever seem to be the people I'm speaking with. Okay. So another form that's available is this one. It's not a form to complete, it's more of an information form. Who will speak for you if you can't speak for yourself? And it goes into how to appoint a substitute decision maker and enduring guardian. That's over there as well. So just to recap, Advanced Care Directive in New South Wales, unlike in other states, there isn't a specific form to use. You can actually write it on the back of this form and write to what your wishes are. But what we are trying to do is have everybody, what we are trying to encourage is to have everybody, if they want to put down what their medical decisions are and aren't, to use the one form. As I said, there's a lot of forms floating around out there, but we're trying to encourage this one that's been put out by the Ministry of Health, New South Wales. Okay. Okay. And that's it there. If anyone wants to take a photo of that, all of these are available online. And there's information online too about the enduring guardianship in New South Wales. Okay. So it's just really important for you to know that an advanced care directive will only be used when you do not have capacity to decide for yourself or communicate your wishes. Your doctor will only consider your advanced care directive to be valid if you had capacity when you wrote it, you made it by choice, it was not forced on you, it has clear and specific details about the treatment that you would accept or refuse, and it applies to the situation at the time. Advanced care planning promotes care that is consistent with a person's goals, values, beliefs and preferences, and it prepares people and their substitute decision makers for making healthcare decisions in the future. Improves outcomes for people, their families and carers, health, aged care, community care workers and the health system in general. And it should be part of routine care and the patient's healthcare journey. And just to reiterate, it's an ongoing process. It's not just a one-off visit that and it's done. It's ongoing. So, as I said, this is an area that a few generations ago it wasn't necessary because all of these modern, wonderful medical interventions that are very, very useful, obviously, weren't around a few generations ago. So people didn't have these really difficult decisions to make. But now it just seems to be that the default is to do everything. And a lot of the time people don't want everything done, but they just haven't had the conversation about what they would and wouldn't like. So that's why it's important. So this is a very important area, and the Department of Health, the Australian government, are focusing on advanced care planning, and there's a lot of different projects going on throughout Australia in regards to advanced care planning. And I just thought I'd show you this ad that is currently being shown in prime time TV in Western Australia about advanced care planning.
Does the Bond music thing go with it?
Sorry?
The Bond.
The Bond. Oh. Oh.
You must have known I didn't want to go into the hospital. I wanted to stay at home in my bed with my things and my Jasper. And your father, Jeff, why on earth would you invite him to the hospital? We'd been divorced for 23 years.
I thought you were still close.
Appearances, you sweet, silly girl. I couldn't bear the sight of him. I suppose I should be grateful I didn't have to talk to him. But you didn't ask, did you?
You never said.
No, I didn't, did I? Oh, well, I guess you'll know next time I dine. Come on, where's your sense of humour?
Yeah, very powerful ad. So you can imagine there's a lot of conversation going on about advanced care planning in Western Australia at the moment. Thank you. So palliative care, and as I said before, palliative care, there's so many myths and misconceptions out there in the community about what palliative care actually is. And those are the sort of frustrations for anyone working in palliative care because of that, people would delay accepting palliative care. And we could be helping a lot more people. And a barrier is that people don't actually know what palliative care is. And I'd just like to tell you what my definition of palliative care is. Anyone that's been diagnosed with an illness that can't be cured, our role in palliative care is to make sure they're as comfortable as they can possibly be, live as well as possible, and support them, but also support their family. That's basically it. It's not all about dying, it's about living well until then. And I always say that people understand that there's different phases in palliative care. A lot of people think it's just end-of-life care or it's just terminal care. When people are referred to us, the 5 different phases that they're in, they could be stable, they could be unstable. We need to sort things out such as pain or breathlessness or OT equipment or something, that we can address. They're unstable. They could be deteriorating in that phase where, a few months, that things are changing for them. Or it could be terminal care. And it's also bereavement for this family as well. So it's not just all about dying, and not just terminal care, it's about living as well as possible, okay? And sometimes, I don't know about Frank, but myself, I feel like, a bit of a salesman. I've got to sell palliative care to people because a lot of the time when they accept us, they always say, gosh, why didn't I accept you guys sooner? I'm so much more comfortable now. So also in regards to palliative care, it's not just all about pain. It's sometimes the symptoms might be physical, but they could also be emotional, spiritual or social. So you don't actually need to have symptoms to need palliative care input. It could be other things associated with what's going on with your illness. So it's a team-based approach to care because it's different things are going on for people, and it's provided also in various locations. It can be provided in hospital, in aged care, in people's homes. It can be provided in other areas. It's not just one place to go to have palliative care. So as I said, it could be things associated with not just physical symptoms where you probably need a nurse and a doctor, but it's the other things as well, social, psychosocial. So we've got a whole team, and it's a whole team-based approach to care, palliative care. So as I said before, we've got specialist doctors, specialist nurses, registered nurses, we've got physiotherapists, occupational therapists, social workers, pastoral care, bereavement, admin support and volunteers. So that's the palliative team. It's not just 1 or 2 people. And yes, you might see all of those people or you might see one person depending on what your needs are. Okay. So linking to palliative care, what we need is consent from the person or an appropriate guardian or family member. It needs to be a medical referral. So we receive referrals from GPs and also medical specialists. In Northern Sydney, the referral form to palliative care is via Hammond Care. Hammond Care oversees a community palliative care team. If in hospital, you can request to be seen by the palliative care team. And just been to Perth for the conference, and they were referring to palliative care as a basic human right, because not everybody has access to palliative care as they should. If in hospital, I'm just thinking in the area in Northern Sydney, Ryde, the Mater, North Shore Private, Hornsby, the Northern Beaches Hospital all have palliative care teams there. So it's just a matter of requesting from whoever the treating team is, or even an emergency, when going in there, can I please see the palliative care team? So what we want for the future is equal access to quality palliative care for everybody, depending on what their diagnosis is, any life-limiting illness. We'd like to improve awareness of palliative care for consumers, but also for health professionals. We'd like to enable people to live as well as possible for as long as possible. And we'd like to provide person-centred care. And the only way we can do that is by getting to know that individual. And we need to know, sort of one of the things that I always say to people when I meet them is, what do I need to know about you to care for you best? You're telling me, I'm not telling you. Okay? So we also want to improve end-of-life care for patients and their families, ensuring their physical and psychosocial needs are met. We want to enable more people to die in their place of choice. We want to prevent unnecessary hospital admissions, especially the distressing presentations to emergency departments, which is usually happening after hours. And we want to improve death literacy. And we also want to empower and enable carers to provide high-quality end-of-life care. So, as before, I was going to touch on the New South Wales ambulance authorised plans. These are happening in New South Wales and it's great. Basically what they're doing is they're enabling paramedics to come out to your home, or they come to residential aged care as well, and it enables paramedics to provide care that is aligned with your wishes. Okay? And these things that they could be providing care may be outside of their usual protocols. So you've had the advanced care planning conversation. You've told us how you want to be cared for, and if that is to be at home, the ambulance can come out and help you. And if you don't want to go to hospital, just because they come out to help you doesn't mean you go to hospital. Okay, so families, the reason why these plans have come about and why they're important is that families or carers call an ambulance sometimes if they're presented with unexpected symptoms or a crisis in their confidence to continue care. Okay? So in this event, the role of the paramedic is one of support for families and carers, as well as providing care to the patient in a manner that respects their wishes. Okay? Because we know that. We know what their wishes are because we've had these conversations. So the authorised care plans have been successful in meeting the goals of end-of-life wishes for patients and ensuring they receive care at their location of their choosing wherever possible, so thereby reducing unnecessary and avoidable emergency department admissions. So back not too long ago, if you called an ambulance, that was their policy, is to send everyone went to hospital to be assessed. Nowadays, the majority of the time the ambulance are called out to somebody's home is because someone's fallen. Okay, so a lot of the time they're not transferring people back to hospital, but what they are doing is they're helping the family and the person, assessing what's going on and just assisting. And if they can, the person stays at home. Okay? So the paramedics are then able to complement existing services and the support that's already being cared for by families and other health professionals, such as the GP and the specialist primary health providers. So this program also strengthens processes, enabling paramedics to support and respect the patient's palliative wishes. And they're written so to differentiate these plans with the advanced care planning and the advanced care directive. These authorised care plans have to be written by the GP. Okay, so it's enabling the paramedics to do things like administer medications that they wouldn't usually administer if needed. So it's usually written in collaboration, but written by the GP. And also includes the palliative care team and family. This is what comes up on the ambulance screen when they get a call out to somebody's house with one of these plans in place. They don't have a great deal of information, but you will have, if you have a plan in place in your home, you'll just keep it on the fridge. That's what's usually advised. Okay. So according to New South Wales Ambulance, 50% of patients attended by New South Wales Ambulance who have an authorised palliative care end-of-life care plan in place are not transferred to emergency department. You can still see there's a large proportion of people that are transferred. And this in part reflects that the New South Wales Ambulance is called for reasons differing to symptoms related to the palliative care plan, or the patient has reconsidered their decision about remaining at home. And that's the other thing about advanced care planning. And these plans, you can change your mind. Nothing's set in stone if you've written it down. If you want to change your mind, You can change your mind tomorrow. Okay. For the patient, it means they have a choice to remain at home for care, and the New South Wales is able to contribute to their wishes. So I just thought I'd finish off with this slide, which is really a good description of what palliative care is. So Piglet sidled up to Pooh from behind. "Pooh," he whispered. "Yes, Piglet." "Nothing," said Pooh, said Piglet, taking Pooh's hand. "I just wanted to be sure of you."
Thank you, Kelly. Yes. Subject's all very dear to my heart. We can provide you with these links afterwards, and we can provide you with all the information that Kelly's been speaking about today. We also, MND New South Wales, also have an excellent fact sheet on these issues as well. So we can give you exactly, I think a few of you have already got the conversations document.